Hamujambo, kaskazini, mashariki, kusini, magharibi. Karibuni tena, tumefika leo, tuko studio. Maswali yalitufikia kwa mpigo na leo tukaleta wenzetu. We have distinguished guests in the studio with us. Daktari pia ako pale ready to answer everything that you sent our way. I am your host Faith Ngami, and together in studio I have my friends
Stacy Joshua Wamwandu, my name's privileged to be amongst the guests.
I am Lena, and I am excited to learn more from the gyno.
I'm Pili. I'm in the health insurance sector, and I'm happy to be here.
My name is Leah. I'm glad to be here today.
And I'm Dr. Karanja, your consultant obstetrician and gynecologist, based here in Mombasa at Jubilee Building, first floor. Karibuni sana. I'm ready to answer all your gynecological questions. Thank you.
Asante sana daktari. We have a 19-year-old who was so concerned. Na kaniambia, I am 19 years and I'm having cramps. Now my friend does not have cramps. Is it normal?
Cramps, depending on the severity.
Mm-hmm.
Mild cramps that don't bother you, that is normal. But if you get severe cramps, and not necessarily severe, anything that bothers you, that you think this one is affecting my normal working, my house chores, at work you're uncomfortable, meaning you're not working as how you'd work on a normal day.
Mm-hmm.
That is not a normal cramp. And it happens, there are some, the cramps start before the periods, na kuna wengine inaanza period ikianza. But majority period ikiisha, cramps pia zinaisha. So you need to come and see your gynecologist so that they see, is there a problem maybe in the uterus? Is there a problem in the pelvis? Is it a problem of the hormones? So that you can be treated.
Oh.
Yes.
But what if it is pain that, of course, I'm not functioning at 100%,
Yes.
but it is pain I can live with. Of course, having taken some painkillers, I can
Yes.
live with it.
And that is what happened commonly. Tuambiwa ishi nayo.
Yeah.
Tumezoea. Hata wa mama zetu, nyanya zetu, come we confirm there's no problem or there's no alarming issue. Then now we can advise you on what to do. There are some we just advise them to take painkillers, brufen, paracetamol, and that's it.
Wow.
The most important part is you come so that the gynecologist can diagnose what is the problem. Yes.
So for me, maybe let me ask, I have a friend, for her, it ends up to she's hospitalized like for almost a week, and she have heavy flow plus the cramps.
The cramps.
Yeah, so she was just inquiring for me, and for me, I told her I've never experienced it, and for me, it's just come and go. So that's all. My question is that maybe she's just seeing a normal physician, not maybe is it a gynecologist intervention she might?
If she's hospitalized, she should be seeing
Yeah.
a gynecologist. And maybe, sometimes someone can explain, and as a doctor, you can try and gauge what could we be dealing with. Most probably, endometriosis is top on the list. Some of the causes of very severe pain during periods. Endometriosis and fibroids. And now that you've added heavy periods or heavy flow, and heavy flow can be in two ways. It can either be your normal days, 3 days, but it's very heavy. And some, it's normal flow, but prolonged. Goes for 10 days. So your period should not go more than 7 days. 7 days is the cutoff. So if it's more than 7 days and it's severe pain, she needs to see a gynecologist. Yes.
So
and the minimum she will need to do is what we call a pelvic scan, so that you look at the reproductive system. Yes.
So, Doc, when you're saying heavy for 3 days, are we counting by the number of sanitary towels someone is using, or OB, or what are we using to gauge whether it's heavy or?
The best usually is if you've been using 3 pads a day, then the time comes you start using 5 and it's fully soaked. Then there's a problem.
Oh, okay.
Also, But we really need to be very objective, because you might find someone using 5 pads, but it's not soaked.
Yeah.
It's because they change frequently. Like after 2 hours they change, after 2 hours they change.
Yeah.
Then there's someone who will use 2, but it's heavy because they don't change that frequently.
Yeah.
So we usually assess in terms of not necessarily how many pads you use, but the pads that you use, is it fully soaked, or you just after 2 hours you change whether it's soaked or not? Yes. So heaviness is it's very subjective.
Okay.
So there are questions I'll ask and I'll know whether it's heavy or not.
Okay.
But if you've been using 3 and now you're using 5, 6, 7 fully soaked, then there's a problem.
Now,
Yes.
Daktari, with that you had mentioned fibroids and endometriosis,
Yeah.
and these are saying it's something that people are going through right now, whether knowingly or unknowingly. How do we differentiate fibroids and endometriosis? What are the early signs that I'm supposed to be alerted that I need to rush there?
Okay. Now, endometriosis, and I have a good chart here usually.
Wow, awesome.
Yes. You all know the reproductive system. Huh?
Yes.
Classics.
Classics.
Classic.
Science and agriculture. So, this is the uterus.
Okay.
That is your ovary over there. And this is the fallopian tube. So fibroids are usually growths on the uterus. Let me just give an example like that. That is a growth that is on the uterus. Or it can be there. Or you can have it grow inside the womb. Okay? This is the womb. This is where the baby usually grows when you're pregnant. Endometriosis is a bit different. You see these cells that are here?
Yes.
We have cells which are here. They're called endometrial cells.
Yeah.
So when you bleed during menses, you shed these cells. That is what forms the periods.
Okay.
Now, endometriosis, you'll have women who these cells migrate. So you find those cells either here in the ovary, you can find them growing here in the tube, you can find them growing behind the uterus. So when you're having your periods, the changes that occur here, the cramps that you get during periods, you also get the same pain there. That's why you get severe pain with endometriosis. And they can migrate anywhere. We've had people with endometrial cells in the brain,
Yeah.
in the lungs,
Okay.
in the abdomen. So they can migrate anywhere. And most of the time we don't know the cause. Yes. So far we don't know what causes endometriosis. Yes. So in terms of symptoms, endometriosis is mainly pain. For fibroids, it can be pain or heavy bleeding, depending on where the fibroid is. Like you see this fibroid here, because it's inside in the womb, this one causes more of bleeding. So you'll have heavy flow. Now this one, it's growing away from the womb. So there will be discomfort and pain because it's occupying some other space. Yes.
Okay.
But majority of women, if you find a woman with a fibroid as small as this, they might have even no symptoms.
Yeah.
So you get pregnant, you deliver, you move on in your life with no symptoms. So most probably this is the fibroid that you might be having. Yes.
On that, Daktari, you've mentioned about when we have the endo cells that are growing on the fallopian tube.
Yes.
And it causes the pain. Is it just during the period, the menses time, because we have people who experience pain during ovulation. So how am I going to differentiate that it can be something, it's just the normal ovulation, this is something, it's the endo pain?
Now, endometriosis, in its severe form, you can even have pain throughout.
Okay.
During periods, after periods. Now, to just answer you directly, the pain of ovulation should not be so severe. Just mild pain for a day. But if you get severe pain during ovulation, it could be endometriosis as well. Yes. So it's the degree of pain.
Okay.
Yes.
Yes, so I know that.
And these ones can cause, most of the time it causes infertility. Because once it grows next to the tubes, it distorts the tubes. So the sperms cannot go through the tubes and the eggs. So you might not get fertilization happening. Yes.
Is it treatable?
Yes, it is treatable. It is.
Doc, I have a question concerning still fibroids. Yeah. One, at what stage, or rather, naturally, at what point does someone begin to have fibroids? Or rather, you can say now, at probably whatever you've been feeling, this could probably has grown to become fibroids too. This myth that when one gets married late or they don't give birth early, like in the early ages, early 20s, is when now you get fibroids. Then I have also seen, it's still in that myth, because when they say, oh, when you get pregnant late, or if you delay in getting pregnant, then you end up having fibroids. In fact, I remember there's a doctor who once was telling me, see, when somebody, when you're supposed to be childbearing and you're not, then the womb has to be busy.
Yes.
So it busy decides to make itself busy with fibroids and
Makes
stuff.
itself busy.
Yeah, it makes itself busy. But so is that a myth, or is that something that is true? Because again, I have seen people who have children, yet they end up
They have fibroids.
They have fibroids.
Yes.
So trying to reconcile the two.
Okay. We don't know what causes fibroids. Yes. Otherwise, if you knew it, we'll treat that cause or will prevent it.
Yeah.
But fibroids are hormone dependent. And just to connect with your question, is estrogen is the main hormone. And you see, when you get pregnant, not only pregnant, during pregnancy and when you're breastfeeding, it's like the hormones are anti-fibroid at that time. There's no good environment for the fibroids to grow or to prosper.
Okay.
Yes, but it doesn't mean that when your uterus is not busy, it is the reason for the fibroids. No. Once you're genetically predisposed to have fibroids, they will come, but we don't know when. Because we have even 20-year-olds who have fibroids. We have 45-year-olds who have fibroids. And we also have women who you'll find the sister or the mother has fibroids, but then they don't have. So we can't tell who will get and who will not get. So that myth is it's true, and it's also not true. Yes. So we don't advise you go get children. So have 10 children so that you don't get fibroid. Because still some have many children and they still end up getting fibroid. But in terms of science and what we've experienced, women who take long to conceive and get pregnant, or maybe have one child and they don't get another child, because of that exposure to the hormones for long, now there's a risk of, if you are already predisposed to have fibroids, they will grow at a faster rate than someone who's having many children. Yes.
And then this, I've also seen whereby you find somebody has various, I don't know what they have after the surgery. Then you realize, because I have seen at least a friend in their photo after the surgery, and had like 13, like what was removed from the womb.
13
was like
fibroids.
13 fibroids.
Yes.
Actually, they look like potatoes that have been peeled. Those things are big. Yet at the same time, someone else also who had a fibroid, what came out looked like a child. Kind of has that form. And so it was a bit weird. So I'm like, okay, so this fibroid business. So is it like things that just pop kauji, or is it like some muscle that end up looking? Because you can even see somebody she looks expectant. You can do he gave me mingiana.
Yes.
So
For
we're waiting
fibroids,
for 9 months and then.
Now, for fibroids, you've mentioned 13. We've removed even 40 fibroids.
Wow. From one person.
Yes, from one person. So you can either have one that is so big that looks like a pregnancy. You can have 30 fibroids that are small and spread all over. Yes. So it depends how long you've had it. Of course, if you don't have symptoms, you don't go to the doctor until you have the symptoms. So it means most probably the fibroids have already grown. Yes.
So now from the chart, such are in the womb.
Yes.
Those are in the womb.
Yes, it's in the womb.
No,
See,
this can hold 40.
This womb, yes, 40 fibroids. They go.
Or even outside.
Yes, even outside, inside like that. All these are fibroids. Yes, some are big, some are small. And sometimes you do surgery. You remove all these fibroids. But you will not remove the cause. Yes. So surgery is usually like the last option.
Should be.
Because you can do this surgery, then after 1, 2, 3, 5 years, they recur again. Yes.
So in that case, what is the cause?
We don't know the cause.
Okay. Because I'm wondering, because there's some people, I don't know if the fibroid becomes too much, they remove the whole womb.
Yes. Now, what we shall advise is, I'll give you a practical scenario. You're 45 years. You have 4 kids. You already have your desired family size. And you come with, like, let's say 10 fibroids. And you don't plan to get pregnant again. So why should I remove the 10 fibroids? Then after another 2-3 years, you're at risk of getting more fibroids. We'll rather remove the uterus.
What procedure is that?
Removal of the uterus. It's called hysterectomy.
Okay.
It's to your benefit because removing 10 fibroids or 15 fibroids, each of the fibroid, you remove this fibroid, there's bleeding. You remove that fibroid, there's bleeding there. You remove that fibroid, there's bleeding there during the operations.
Okay.
So removing all these fibroids, it's more riskier than just removing the uterus. Yes. But we will discuss with you the pros and cons. It's not for everyone. You discuss the pros and cons. What happens when I remove the womb? What will happen when I remove the fibroids only? Then you decide. Okay? Yes.
Oh, wow. Yes. This is I'll say now, I'll jump into pregnancy.
Yes.
Now that we've mentioned the womb and pregnancy goes right direct. So when it comes to pregnancy, for somebody let me just divert a bit. What happens during an abortion? What exactly happens during an abortion? Because we have cases whereby somebody does an abortion and the womb is there. Another one does an abortion and the womb is totally gone.
Okay, I didn't catch that. During you induce when you miscarriage?
Yes.
During a miscarriage?
Yeah, during a miscarriage. So, there is a miscarriage and there is what I think others call it I'll say an induced miscarriage, which now ends up being like an abortion.
Okay.
Yeah. So what happens? There are times whereby it's just the fetus. No, I think at that time it's an embryo that comes out and the womb is still okay. And there are times whereby the womb is entirely messed up.
Okay, I think you're mentioning complications of either miscarriage or abortion.
Yes.
There are those who, when the pregnancy comes out, there's a part that remains, not the whole pregnancy that comes out. So either you continue bleeding, you might get an infection, and this might even lead to infertility later in life. So if you have a miscarriage, you're advised to do a scan, a pelvic scan, so that we see, is the uterus okay and does everything come out? And of course, you're treated with antibiotics as well. Yes.
Okay. So look, just on that, can you have like a miscarriage and it seems that the pregnancy didn't really come out, yet you miscarry?
many women, when they're pregnant and they bleed, maybe in clots, some will assume the pregnancy has come out. And more so when the pregnancy is still very young. So you can actually bleed. The people even bleed for 2-3 weeks. But when you do a scan, the pregnancy is still intact.
Oh.
Yes. So we shall advise the moment you bleed or you even see spotting, even minimal spotting. Because women are usually told, ukiona damu kidogo when you're pregnant, that is normal. No, you need to go see your doctor. So they do a scan, they make sure the baby is okay. And there's some who bleed and they're told itakuwa sawa. Then the baby dies while in the womb. And they stay for like 2 weeks, 3 weeks. Then they know the pregnancy is still intact. Then after some time, the pregnancy symptoms go down. So they get concerned. When they come to the hospital, unfortunately, you do a scan and you find the baby is normal. So anytime you see spotting or there's a problem, just visit your doctor.
Okay.
Isn't that supposed to be like when a child, the fetus is dead? Isn't that toxic to the body for the mother now?
When you say toxic is a very toxic word.
Okay, because like I've seen scenarios where
I understand your question. In the initial 1, 2, 3 days, it might not. But if it stays for long, now the complications come in. Infection, of course. There's what we call, there's a problem in coagulation, so that when you start to bleed, it might be difficult to stop that bleeding. So it's not good to stay with a baby who's not there for long. Yes, but I prefer not to use the word toxic.
Okay, because I use the word toxic probably because I know a scenario where there's someone I knew who was really desiring to get children. Then she got pregnant with triplets, and then at some point they probably I think on her second trimester. During her second trimester, towards the end, I think of her second trimester, then one of the baby died, and it was not noticed. So by the time she goes to the hospital and all, because of the dead fetus, it affected her.
Plus
so they all died, including her.
Oh, that's very unfortunate.
Yeah, but you say it came from. I mean, by the time they notice now that there's a dead fetus, it has. The whole environment, that said her body had become toxic. So even if they're trying to save her, but she passed on.
Okay, maybe one of the complications happened, maybe an infection, or maybe what I was saying, what we call coagulopathy. Maybe she bled a lot. Yes, but that's quite unfortunate. Rarely happens, but yeah, it can happen.
But still, probably if I may ask about the pregnancy, ectopic pregnancy, at what spot? Because I think it's also a bit dangerous. I don't know.
Yes.
So here you are, you're expectant. You don't know it's ectopic, but maybe you're just feeling some severe pain, probably. For how long do you get maybe rushed to the hospital to be checked and for it to be taken to be sorted out before it becomes something else?
When you're pregnant and you have pain. Cramps. Cramps once in a while, that's normal. But if it's persisting or it's increasing, rush to the hospital. Because an ectopic which has ruptured is very dangerous on the mother because you're bleeding on the inside. So you might not be bleeding outside, but it's internal bleeding. You need to rush to the hospital immediately. If you have pain that is worsening or pain that is persisting, you visit the hospital. Because there's no sign you'll get to tell you that this is an ectopic. Not unless you go to the hospital. Yes.
Sawa. Thank you for that, Daktari. On matters now concerning health, the vaginal health, and what is it that, we've had several, naambiwa osha na sabuni, wengine nakwambia no, just water is fine, the vagina cleanses itself. What is this health, and how should I take care of my vagina? How should I take care of the entire system, reproductive system, to make sure that I am in a safe place, myself, and even probably for my partner?
Okay. I think you've started by answering the question. The vagina cleans itself.
Okay.
Yes. Obvious things first. Diet, of course.
Yeah.
You have a balanced diet. Exercise is good. Good menstrual hygiene.
Okay.
So when you're during your menses, you have to be clean. You have to change your pads like after every 4 hours, or even earlier if you're a heavy bleeder.
Okay.
If you bleed a lot, and most of the time the first 2-3 days. Some people the first day, the second, after the third day, the bleeding comes down.
Yeah.
Now we shall advise you don't have to clean your birth canal. It's clean.
Yeah.
Just clean the outside. And the inside, it cleans itself. Okay. If by any chance it was dirty, then it means even during your periods, we'll be telling you to scrub.
That's true.
But we don't.
Yeah.
Naturally, it cleans itself.
Yeah.
And the most dangerous thing when you clean inside, you affect what we call the normal flora. The normal flora is there's some organisms in the vagina that is good for you. It prevents other infections and it maintains the pH.
Okay.
So if you clean there na ushindi,
Unakuwa mshindi.
so you actually risk yourself getting more infection. Yes. So it cleans, just clean the outside.
Okay.
We do water.
Water.
Okay.
Yes.
So in that line, when it comes to shaving for a lady, is it a shaver? Is it waxing? What is hygienically acceptable?
Yeah.
And then also
both are acceptable.
Include
So long
ingrowth
as-
hair.
So long as it's hygienic.
Okay.
You don't touch
Yeah.
inside.
Oh,
Yes.
okay.
Outside there, you can do anything.
And because of that, we always told you need to take probiotic, you need to take pineapple. It helps you with, let's just say, scent.
Yeah. Probably that will lead to another question. Yeah.
When you're doing for the probiotics,
Yes.
when you're given an antibiotic,
Yes.
we shall advise for women, it's good to take a probiotic.
Okay.
Yes, because the antibiotic also kills the normal bacteria.
That's the normal antibiotic you take for,
Yes.
it's infections and
Yes.
stuff.
Okay.
Because antibiotic is to kill bacteria.
Yes.
Okay.
So it also kills the normal bacteria
That is
in
me.
the birth canal. So you also take a probiotic.
Probiotic.
Yes.
So is the yogurt bit of it okay? Is the bacteria in the yogurt
the
enough?
yogurt is okay. So it's true, yogurt helps. But it should be pure yogurt.
Naturally there.
Yes.
So I get it plain yogurt.
Plain yogurt.
You know, most of
No,
us.
I meant plain, not pure.
Yes,
Plain, not
plain
pure.
yogurt.
Plain yogurt.
Yeah.
Yes.
But, is it possible to measure the levels of bacteria in the respective yogurt containers? Because at times you get like product X, company X is very expensive. Company Y is averagely, and then this other one is for all of us. So,
Those are just marketing. Just look for plain yogurt.
okay.
So long as there are no, avoid sugary yogurt,
Okay.
sugary stuff.
So that means sour milk can suffice.
Yes.
So you will all pay me.
Thank you, madam.
And then now, we've also been encouraged to eat pineapples to make it smell yummy. Does it work? Does it work?
Eat as much pineapple as you want. Because pineapple doesn't have any side effects.
Oh, okay.
But whether it makes it yummy or scented,
Juicy.
Ukikula pineapple.
maybe the men should tell us.
Still on that, I think
Yes.
the yummy part is in this what is this? I don't know if it's a myth or what. That again, eating is it the pineapple? What again makes it too watery?
Cabbage.
I think you mean cabbage. Cabbage is a cabbage is a very good food. Just eat your cabbage.
Whether salad, cooked.
It's all about moderation. Huh?
Oh, okay.
You don't eat cabbage at every day.
Yeah.
It's good for your health. Yes.
So it does make you a bit water.
No.
Doesn't. So it's a myth.
It's a myth.
We can try then. We will.
Generally, for our down here to have the standard smell that it's supposed to have, how will our exercise and our diet affect that? So what are we avoiding majorly?
You know, the reproductive system depends a lot on the hormones.
Okay.
And for your hormones to be well balanced, that's what the term everyone uses. You need to be fit. You check on your weight. Take a balanced diet. All these will affect your hormonal balance.
Okay.
And also the normal flora that I've talked about.
Okay.
Yes. So it's just about balancing everything.
Okay.
Yes.
Okay.
But don't be too conscious. You don't need to have a birth canal that is that is perfumed.
Rose water.
But you know
But
there are
have it
risks.
clean.
Yes.
Have it clean.
You know there are risks people do out here. Oh, let me just pour strawberry ice cream so that
Yes.
you are
Yeah.
nearly
There's steaming.
Is it
There's some herbal
is
things
it
that
safe?
people
Yeah.
don't.
It's not good.
even if I want to bumper my months? You know what I mean? Okay.
Don't go to the
know.
extreme.
So, Doc,
Okay.
Yes.
Okay.
What happens when a woman uses these products that are recommended for washing the vagina? What happens?
First of all, don't wash the vagina.
Yeah.
More so the inside. Okay? Just wash the outer part. If you really want to wash inside, what we shall advise, you just part the lips and you pour some water. That's enough. The products that you use, first of all, do you know what is contained in those products? And the main effect of those products is on the normal flora of the vagina.
Okay.
So that when you're trying to clean, to remove the dirt, you're also removing the normal cells, the normal flora, and now you predispose yourself to infection.
Infections.
Yes.
Okay. Very clear.
Kawache tu kajioshe.
Okay.
Yes.
Okay, so Daktari, for me, let me ask, how does high blood pressure affect health or lack of health in pregnancy?
Okay. Now, high blood pressure in pregnancy. It's a very dangerous disease in pregnancy. And it only happens, that is the blood pressure rises during pregnancy. You're not you've never taken pressure drugs. Your pressures have always been normal. When pregnancy started, your pressures were okay. Then along the way, your pressure rises. Okay. And some of the most common symptoms are you get swelling of the limbs, swelling of the hands, swelling of the face. And people will tell you, you remember yo.
Yeah.
Tulia. So you need to go check your blood pressure. Now, the main danger with high blood pressure in pregnancy is that at the placenta level, where now there's the mother now supplies blood and nutrients to the baby. Blood should move freely between the mother and the baby. So when you have high blood pressure, the baby does not get enough nutrients and enough blood. So with time, you might go do a scan today, you're told your baby is 2 kg. After a month, your baby is still 2 kg.
Yeah.
Or even less, or slightly more. So that is the main danger. It interferes with blood flow into the baby during pregnancy. And also it can affect the mother because the blood vessels of the mother are also affected when the blood pressure is high. Yes.
Wow.
Okay.
That's why in every clinic, the first thing they do, they check your blood pressure.
Yeah.
Yes. And of course, you'll be put on treatment.
How bad is gestational diabetes at this point?
Gestational diabetes is mainly, it's like the blood pressure, but we call it gestational because it starts during pregnancy.
Okay.
Now, for gestation is the opposite. Instead of the baby being small, the baby now is bigger. You do a scan, you're told you're 36 weeks, and yet you're 32 weeks
Yeah.
because the baby grows bigger. And that is also dangerous for the baby. During pregnancy, during labor, and also after delivery.
Oh, okay.
Yes. So your sugar should also be checked.
Be checked. Oh, okay.
At the point you come into the clinic, and at around 28 weeks, there's a special test we do to check the sugar.
Oh, okay.
Yes.
Now, there are these blood clots that an expectant mom, some mothers experience that
Yes.
have made some die. What is the cause? Then at what point do I realize that I have blood clots as an expectant mother?
By blood clots, you mean like thrombosis or?
Yeah, you just hear.
Okay, there's some, when you get pregnant.
Or is it the blood cannot also thin?
Yes.
Yes.
That's why I'm trying to. When you're pregnant, your blood should move freely
Yes.
in the artery and in the veins. So when you get pregnant, somehow it slows the way the blood flows.
Okay.
So you might get commonly you start swelling of the limb, but it's only one limb. Sometimes it can be two, but commonly one.
Okay.
It's because one of the vessels has blocked and it has a clot.
Okay.
And that clot might migrate and come to the lungs.
Okay.
That's when you have the mothers get a blood clot and they just drop and die. Yes, but it's treatable.
Okay.
It's treatable. And we shall advise when you're pregnant, be active. Walk around. Don't keep on sleeping and staying at home, and be active.
So ideally for an expectant mother, just be active to avoid certain things.
Be active, yes.
Okay. Even if I'm going to be a CS mother.
Yes. So you're going to heal.
Yes.
Because of healing.
Okay.
Because after the operation, by the next day, you need to be walking around.
I hope my friend hears this. She needs to walk. She says, I'm a CS mother. I don't need to walk. I just swim and lose the weight. Okay. Because of healing now at this.
Yes.
Okay, that's clear.
Still on pregnancy, my question would be, why is it that some women labor for longer while others labor for a shorter period of time? What determines the kind of labor a woman gets?
Now, during labor, there's something called the 3 P's. We have power, passage, and passenger.
Okay.
So the passenger,
The passenger is the passenger is the passenger.
3 P's. The passenger is the baby.
Yeah.
The power is the contraction.
Okay.
And the passage is the birth canal. Yes. So if any of these 3 has a problem, that is what happens. Yes. Like if you have a big baby, that is a problem with the passenger. If your pelvis is small, there's a problem with the passage. If your problem is
The
contractions, there's a problem now with the power. Yes. So if any of the 3 has a problem, that's when you have some women go into labor for long. Yes.
Because it can be, you are being decent when you say for long. For long.
I don't understand.
With that, Daktari, do we have women who have inverted kind of birth canals and some who the birth canal is normal?
Inverted?
Okay, we tend to hear mtu anaambiwa yours is you'll need CS because you have an inverted kind of birth canal, maybe where
birth canal is, I think it's a cervix.
There's cervix, yeah.
And there are people who, instead of it being like this, it's
No, it's the bones.
It's the bones.
Yes.
So, but
Yeah.
You see, the bone here. Let me not point.
Yeah.
Feel free.
Yes, the pelvis.
Okay.
For men, the pelvis is like that.
Okay.
But for women, that angle is a bit. It's not acute.
Open.
Open. So the baby can
come.
come out.
Yeah.
So if your angle is narrow, then that baby can't come out.
So that is CS.
Yes, that's yes.